started in a minute. Settle in a little bit. Okay, well, welcome to the session on Democratic candidates for governor. I'm Bobby Peterson, Executive Director, Public Interest Attorney at ABC for Health. It's nice to see a lot of familiar faces here today. We just had a very energized legislative panel speaking with a lot of passion, a lot of issues that we all care a great deal about: access to health care and coverage issues, connecting people to services, some of the things that we can do better in Wisconsin from the legislative end that help us do our jobs and help connect people to coverage here in Wisconsin. Today, I'm very privileged to introduce a number of the candidates Democratic candidates for governor of the state of Wisconsin. We're going to have them give a very brief introduction, and then we're going to run a couple videos of people that weren't able to make it. Then they're done, and we get to spend time with the candidates that are here today with some questions and answers. So let's start with just a brief introduction, beginning with Mike.
Hi everybody, good morning. I'm Mike McCabe. I come from a farming background. I grew up on a dairy farm in Clark County, about halfway between Eau Claire and Wausau. That's important because we are not going to get a new governor, and we're not going to have our values reflected in state actions and state laws by only winning in places like Milwaukee and Madison. We have to win in places that have been written off and where we are not seriously competing. There are too many forgotten people in forgotten places around the state, and that has to end. I've spent most of my adult life as an independent watchdog working to expose and break the grip of big money influence in politics. That's an incredibly important motivator for me to be in this race as well, because we are not going to get good health care reform from a sick political system. We're not going to get living wages from a dying democracy. We're not going to get clean air and clean water from dirty politics. We're not going to get anything more than thoughts and prayers after each mass shooting when elected officials are paid not to offer anything more than thoughts and prayers. So we have to shake up and transform a political system that works spectacularly well for a few at the very top and is failing the rest of us. In one of America's darkest hours, as the country plunged into the Great Depression, the greatest president the Democratic Party ever produced said, "The forces of organized money are unanimous in their hatred for me, and I welcome their hatred." I'm running for governor to revive that spirit in our time.
Thank you, Mike. Kelda?
Thank you, Bobby. Good morning. My name is Kelda Royes, and I'm running for governor to restore opportunity and fairness to our state. I want to make Wisconsin the best place to raise a family and the best place to grow a business. And we cannot do that until we guarantee that every single person in this state has access to great health care. A little bit about me. I was born in Marshfield and grew up in Medford and Madison. After graduating from the University of Wisconsin Law School, I did not go take a high-paying corporate law job. Instead, I went to fight on the front lines for access to health care as executive director of NARAL Pro-Choice Wisconsin. There, I worked on issues like reducing the terrible racial disparities in infant mortality. I worked on access to birth control, making sure that immigrant women had access to health care, and of course, protecting the right to abortion. And after my time at NARAL, I decided to run for the legislature because I felt like we needed to do something about health care in a much broader way. I knocked on 20,252 doors, won my seat, and served as a vice chair of the Committee on Health and Healthcare Reform, where I helped expand Badger Care to over 80,000 Wisconsinites, the first time that Wisconsin had covered low-income childless adults. I would like to do that again as governor. After 2 terms in the Assembly, I decided to start my own business. And for the last 5 years, I've been an entrepreneur and a small business owner. And one of my biggest challenges, and what I hear from other entrepreneurs around the state, is getting great health coverage for our wonderful employees. We need to build on the Affordable Care Act by expanding Badger Care as a public option, and I'm really excited to talk with all of you about your ideas, because in my view, ABC for Health is one of the most important partners that we have in the Capitol for making health policy, and I hope I can earn your vote today and your support in the future. Thank you.
Thank you, Kelda. Kathleen?
Thank you. It's good to be here. I'm Kathleen Vinehout I'm a senator from Western Wisconsin. I represent the city of Eau Claire and all are part of 9 counties in Western Wisconsin. I've been a senator since 2007. Before that, I was a full-time dairy farmer. I had the unfortunate experience of being without health insurance for almost 2 years and having a son get sick during that time, which he's okay. 3 scars later and a $15,000 bill. We've figured out how to take out a second mortgage to pay the bill. I got involved in the legislature because of health care. I spent the first 6 months here in the legislature putting together a plan with Senator Miller and Senator Erpenbach called Healthy Wisconsin, which some of you remember was a plan that would have covered everybody in the state and saved $1 billion. Before I milked cows, I was a full-time university professor. I ran a program, the graduate program in health administration. Before that, I spent about 10 years working in various jobs in healthcare. My first job was as a nurse's aide. So I've known healthcare from the bottom of the barrel, from the farmer side, from the professor's side, and now from the legislator's side. I feel like I've seen every side of it. I have a really good idea on what needs to be done, and you and I have talked about that over the years for those of you that have been involved, and I'm anxious to get to work and get the job we've talked about done.
Thank you, Kathleen. Dave?
Hi, everyone. I'm Andy Gronick. I was born and raised in Wisconsin, grew up in Milwaukee. I'm the outsider in the race. I'm before all kinds of professionals in healthcare. If you're a healthcare provider or involved in the healthcare business, would you raise your hand? Pretty much everyone, right? So we're up here as people trying to tell you guys the kinds of things that are most important for healthcare. That's part of a broken system. We should be right in the middle of your tables, listening to you, looking for advice, taking the best ideas, and making them work in the state of Wisconsin. That's how this process should work. I am a problem solver. I spent 35 years working with troubled businesses that often could not go to a bank and get a conventional bank loan to solve problems, access capital, grow, and create jobs. My entire 35 years. And you do that by being collaborative. You do that by putting this table in the middle of all of your tables and finding the best ideas, putting a plan around it, and making sure that it works. Attacking a healthcare system is nuts, okay? Nuts. For the Congress to go after ACA, for our governor to support those efforts, to tinker with a process that will have consequences and unintended consequences is absolutely crazy. So I'm here to discuss with you some innovative ideas for healthcare, but this is the beginning of the process. This is not the end of the process. I'm a guy who has Crohn's disease. I'm on ACA. My entire family is on ACA. I'm one of the people who is at risk of losing my health care because of what's going on. I was that invincible teenager who, on my very first day of football at the University of Georgia, threw up blood. That was not a good thing, by the way. They couldn't figure out why, and didn't figure out why because diagnostics weren't that great at that time. In my invincible 20s, I found myself in the hospital for about 3 weeks after a 9.5-hour surgery. That is the point they found out that I had Crohn's disease. Fortunately, they were able to take care of some things surgically and put me into remission for decades. I was a guy who bought a house, and after 7 months in that house, found that it was contaminated with toxigenic mold, that it made my entire family sick. Healthcare is vital to us all. Having a governor in place that understands exactly what we need to do as a state to make sure that healthcare is available to everyone is what I'm all about. It's one of the big reasons why I'm here. So I'm looking forward to this conversation, but this is the beginning of the process. This is not the end of the process. I'm looking forward to talking with all of you, to getting your best ideas, and to formulating a solution that gives everyone in the state of Wisconsin access to affordable health care, period. It's a right.
Thank you, Andy. Mayor Soglin.
Thank you. Over the last couple of decades, as I've served on the Madison City Council and 21 years as the city's mayor, I've learned a few things. And while the responsibility of governor is going to mean dealing with infrastructure issues, telecommunications, the internet, one of the focuses has to be how do we provide for strong and healthy families. And during that period, I've come to realize that there's five essentials that are critical for a healthy household. The first is housing. And to say housing first is more than just a phrase. Without the housing, there cannot be effective addressing of the other issues. And those are transportation, which gets people to schools and to jobs. It includes education and job training. It includes quality child care, something we addressed as early as the 1970s when we set up the City of Madison's certification program, and suddenly found that surrounding communities wanted to be certified by the City of Madison. And when we asked why you're not in the city, the child care centers said, well, parents have come to expect that certification. They've come to realize that what it means in terms of training, what it means in terms of parental controls. And therefore, we want you to certify us because the families are asking for it. And then lastly is health. And when we get to health, we've got to understand there are so many complicated facets to it. For example, we have to address behavioral health. I'm very proud that over the last several years, the City of Madison has been part of a network led by the First Lady of New York City in tackling the challenges of behavioral health and the questions of opioid addiction. It includes nutrition. If you ask teachers, what is the greatest impediment to a child learning during the day? It's hunger. And then there's the obvious challenges of violence. And we're now coming to realize that violence is a matter of public health. Lastly, within that critical area of health, we have to come to realize that we have done some effective things and we may not understand them. For example, from the late 90s through the 7-year period into 2005, here in Madison, for 7 successive years, we saw black infant mortality decline steadily to the point where it was as low as white infant mortality. And we don't completely understand why. But we have to make a commitment to learn from our own experiences and, as we are attempting to do now, replicate that success and replicate it for all families. Thank you.
Thank you, Mayor Saugen. We're going to roll the tape now of Matt Flynn.
Thank you. I'm Matt Flynn. I'm a candidate for governor. By way of background, I was the chairman of the State Democratic Party for 2 terms, and during that time we elected a great governor, Tony Earl, and the legislature we re-elected Senator Bill Proxmire. I'm a Navy veteran. I live in Milwaukee. I've practiced at Quarles and Brady my entire career, and my wife Mary and I met at the University of Wisconsin when I got out of the Navy. She was a student there, and she's from Monroe, Wisconsin, and we married 41 years.
Excellent. As you know, the people at our conference today are interested in hearing from the candidates for governor from the Democratic Party. The candidates, one of the questions that they have is that they're concerned about is access to health care coverage and some of the issues about the people that they work with, low-income folks, middle-income folks. What are the top 3 things you think you can do as governor to help promote access to health care coverage for people in Wisconsin?
Well, there are 3 things, and a major reason why I'm running is simply this, and because in Washington, Donald Trump has corrupted our government, and Madison, Scott Walker's corrupted it. So the 3 top health care priorities are these. Number 1, I think everybody should be covered by health care, and I would advocate for Medicare doing that, but as governor you can't enforce that. But I can open Badger Care to everybody, and I will. Secondly, I will advocate very strongly for Obamacare, the Affordable Care Act, because that's done a great deal to bring down healthcare costs. And the third thing I would do is fight very hard to get that Medicaid supplement money that Scott Walker turned back, that $1 billion of our own taxes, our own federal taxes. And I would bring as much healthcare money into the state as I could.
Great. One of the things that we're concerned about that as we work with clients of ABC for Health and other people here as a part of HealthWatch work with low-income populations, helping them navigate the system, is that when people don't have health care coverage, they incur medical debt. And in Wisconsin, medical debt totaled about $1.6 billion in 2013. That dropped by 2015 to just about $900 million. But it's on the way back again. People speculate that's because of the disruptions of the Trump administration or Scott Walker because they haven't embraced the marketplace. Uncompensated care is a problem because we all pay for it. Do you think that some of the things that you're proposing will help reduce that uncompensated care?
I do, and it is obvious that the uncompensated care numbers have gone up precisely because the Republican Party has relentlessly attacked the Affordable Care Act and relentlessly attacked anything having to do with the marketplace that could correct this. So the three things, ultimately, the best rein on costs. Part of the issue here is the high costs and the unnecessarily high costs of health care. And that will only be cured when Medicare covers everybody from birth on. When that happens, Medicare is a good steward of keeping costs down. But until that happens, what I think opening Badger Care to everybody for a premium for those who can afford it, getting back the $1 billion that we were cheated out of by Scott Walker, and third, the bully pulpit. I mean, it does matter if a governor is relentlessly advocating for the Affordable Care Act and for universal coverage.
Yeah, one of the issues that's come up that we've discussed is the Medicaid funds that weren't directed back towards Wisconsin. The $1 billion, some say it's even more than $1 billion, but one of the factors involved there is that money helps promote economic development across the state. I think that's, when we look at things like Foxcom that are focused on southeastern Wisconsin, which may or may be good, but a Medicaid expansion would hit every single county of the state with additional funds that supports the medical infrastructure. Do you feel that we can help promote, the program by strengthening it with these dollars coming into the state?
Right. The $1 billion he turned down was gratuitous. He did it because Kasich and Christie had taken it. He wanted to look like a conservative in that presidential race. That $1 billion would have circulated throughout the state. The $800 million in train money of our dollars would have circulated throughout the state. The $4.5 billion Foxconn tax that he's imposing statewide is cash out of our pockets. If you add those three figures up, he's cost the state $6.3 billion just because of his distorted idea of what a conservative is. And he's a clear and present danger to the state, as is the Republican Party. So I would fight all of those. I'd fight for the billion and the $800 million to get them back. I would fight I will bring suit for an injunction to stop Foxconn when I get in. But your core question, yes, that $1 billion would have been earned, spent many times.
Right, and hopefully created some jobs as a part of that process too in the medical community. Well, thank you very much. Are there any other last comments you'd like to make to our audience?
No, I think that the Republican Party is corrupting this country in Washington through Trump, betraying us to the Russians and dividing us ethnically and racially. And in Madison, Scott Walker is simply a mule, a policy mule for a Republican donor cartel. And I think we need a strong, forceful Democratic campaign against both of them.
Thank you very much. We appreciate your time, and time permitting, we'll be able to include all of your comments. Thank you very much.
Thank you very much.
Okay, next we're going to go to State Superintendent Tony Evers.
Hi, I'm Tony Evers. I'm a Democratic candidate for governor. I'm also state superintendent of schools. I've actually run 3 times as state superintendent, and the last time I received 70% of the vote, and I won in 70 of 72 counties. A little bit about where I'm running. Frankly, we've got a lot of broken promises from the present incumbent, Scott Walker, and we really have to focus on what's important, not only for our kids. What's good for our kids is certainly good for the state, but what's really good for all of us, including our children, is to make sure that we have the best healthcare system in the United States of America, and we've got a long way to go. First thing I do, one of my priorities clearly is to take the Medicaid money. Scott Walker has left that money in Washington, D.C. for the last 8 years, and we have to take care of that, take advantage of that expansion. The other thing we have to make sure is that I'm a cancer survivor, so I get it. We have to make sure that pre-existing conditions do not interfere with people getting health care and health insurance in the state of Wisconsin. And we have to find ways to drive down costs. And I'll just give you a few examples of how we can do it. First of all, just no matter what you talk about, having transparency in any area is really important. But especially in this area, you know, I get health care bills and health insurance bills just like all of you get. And the transparency is it's hard to navigate. So we need to have greater transparency. And we have to take a look at why Wisconsin and Minnesota are so different in this issue. The same coverage in Minnesota in the Affordable Care Act costs 1/2 of what it does in Wisconsin for that same coverage. It's about the Medicaid expansion. It's about making sure that we set up the exchanges properly. Another way to drive down costs, in addition to transparency and taking care of the Medicaid money, is to make sure that we have to focus on the rural areas of the state also, to make sure that providers are given incentives to work in rural Wisconsin, or with loan forgiveness, things like that. And of course, one thing that's always forgotten when we talk about health care is we have to make sure that we invest in preventative care. My daughter's a physician. She always reminds me of that it's not just taking care of what's happening now. We have to actually prepare and make sure that we take care of ourselves before we get ill, before we get these diseases. And preventative health care is real important. There's also some protections that we can look at. The whole issue of water in this state is important. It's a great natural resource, I get that. But when we have lead pipes in this state, and we have kids in Milwaukee or Watertown or Buffalo County, Wisconsin, having the toxicity of lead in their water that they're drinking out of their faucets, that's causing them to become ill, we need to be able to make sure that we have those protections in place. We also passed a reinsurance bill recently, which is really going to be a good thing as far as kind of stabilizing costs, but we really didn't put in those protections that consumers need. This has to be more than just protecting our insurance companies. We have to protect the folks in the state that are the consumers. We need consumer protection, more consumer protection in the area. And last thing I'll talk about is the issue of opioids. It's clearly a health scourge in this state. We need to invest in it. We need to have diversion programs to make sure that people, instead of being arrested and thrown into prison and around opioid abuse and frankly other abuse, we get them into diversion programs and they get the treatment they need. Our healthcare system is not well in the state of Wisconsin. If we take the steps that I've talked about today, I know we can have a healthier Wisconsin. Thank you very much.
Okay, great. We're going to run through the candidates again and ask our specific questions on access to health care and coverage. And what are 3 things as Governor, Mike, that you would push for and seek to accomplish for the state of Wisconsin for access to health care coverage and services for people?
The first thing is to do everything humanly possible to capture that federal Medicaid expansion money, to be able to make Badger Care available to far more people. We can get 80,000 and some more people onto Badger Care doing that, raise the Medicaid reimbursement rate to capture even more federal money. That's step 1. We should not stop there, however. By changing a single word in state law, we can make Badger Care a public option available to anybody in Wisconsin regardless of income. Badger Care should be there for all Badgers. The eligibility requirements are spelled out in state law, and then it says if all of the following apply, you're eligible. If we change the word all to any, we make Badger Care a public option available to anyone to buy into in Wisconsin, and should take that step. The third thing I would say is really surgical. We need to cut out the cancer that is growing in the body of democracy. We have a system that will not produce health care reform will not produce good health care policy for the people of Wisconsin so long as we have the cronyism and the corruption and the legal bribery that we have in our political system today. We have to cut that cancer out of the body of democracy.
Okay, Kel, and if there are comments that you agree or you say, yes, I agree with Mike, but feel free to distinguish, but what are your three agenda items?
Well, I've long been a supporter of single-payer health care, a Medicare for all system, and I was an author of Healthy Wisconsin. But as governor, regardless of who's in the legislature, my first act will be to accept the Medicaid expansion money from the federal government. The second thing I'll do is try to set up a state exchange that I worked on with John Richards in the Health Committee and make Badger Care a public option so that anyone can buy into it. And the third thing I'll do is try to expand consumer protections for health consumers. We need to make sure that insurance companies are, that we're increasing the medical loss ratio over time so that they're spending more of their claims money, their premium money on claims, and making sure that they are doing what they need to do in terms of delivering the care that people think that they're actually buying. Thank you.
Okay. Kathleen.
Thank you. Well, like every other candidate, we need to accept, I agree, we need to accept the federal Medicaid money. I do take issue with one of the candidates about changing a single word. As you know, the eligibility is in statute, so that means that we need the legislature to help us change the law, and it's not just one word. I wish it was that easy. But we can change the statute, and we also need to think about what we're going to do with the cash when we gain the extra money, because as you know, we're going to have cash coming in because now Badger Care is paid for by the state, and the FMAP will change, and that will bring up our cash available. We see a crisis right now in access to mental health and services for those wanting to go in recovery, suffering from addiction. I believe we need to create a community-based mental health and addiction treatment infrastructure, working with the counties. When I say community-based, I mean working with the counties. This, making sure the counties are our full partners, so that's step one. Secondly, we need to create a Wisconsin-based exchange. A lot of my colleagues in this race talk about taking Badger Care. We need the exchange to be able to do that. I'm grateful that Kelda signed on to the bill back in 2010. I've written a bill in 2010, introduced it in the legislature every single session. Since then, I've changed it as it's needed to be changed. That gives us the opportunity to, having our own state-based exchange gives us the opportunity to do some things to lower costs using the powers that the Affordable Care Act gave us and the powers of the Office of the Commissioner of Insurance. Finally, we need to use research to drive our decision-making. This is something that's not often talked about, but many of you know firsthand the problems of the benefit structure and how benefits have been chipped away. This is something, to a certain extent, that the governor can do to change the benefit structure because it's not as spelled out in statute. And I think about one simple thing to talk about preventive care. A person able to get Badger Care is limited to 30 physical therapy visits in a year. Now that's an example of a policy that really needs to change. If we're going to focus on prevention, we need to make sure that access to those mid-level providers is not hindered in any way. We could talk about prenatal care. We could talk about all of the 40 years of research that we have on prevention that is not being taken into account when we think about the decisions that are being made by the Department of Health to limit services.
Hi, everyone. Andy Gronick again. Okay, so of course, take the Medicaid expansion. That one's easy. 2, really hard to change one word, and I think oversimplifying healthcare, as all of you in this room know, really doesn't work. Our president thought healthcare was easy. Healthcare is incredibly complicated. And when something's complicated and you're tinkering, you're going to have unintended consequences. The fact that we went after, the Congress, Republicans in Congress, went after healthcare has put our rural healthcare providers at risk in the state of Wisconsin. What happens if they fail? Those towns go away. So we have to have a very thoughtful approach. So at the risk of doing laundry list for you, listen, you fix ACA. It's always about continuous improvement. Nothing is ever perfect. You always want to make it better. But to take a bulldozer to a process when you need a shovel is ridiculous. So let's bring people again around that table. Let's find better solutions for ACA. Let's expand preventative health care. If you want to save money, let's make sure that people, to the extent that it's possible, don't get sick in the first place. The fact that we don't treat high blood pressure in some of the people in the state of Wisconsin and wait for it to become kidney disease and dialysis is a nutty, nutty thing, and you all know that. Let's get nurses back into our schools so that we can work proactively with kids and we can form a bridge with their parents and their families to identify, again, opportunities to be preventive. How about early screening of mental health? Obviously in the news right now, but critically needed in the state of Wisconsin. Let's make sure we're funding those kinds of programs. Let's promote healthy lifestyles, diet, exercise, things that we know are going to prevent people from getting sick. Those are some of the things we should be doing in Wisconsin. We could look at a clinic structure that could triage patients so that there was a lower cost of identifying when there was actually a real issue, and then advance those patients to other healthcare providers when needed. Let's support organizations like Planned Parenthood that provide health care to 60,000 women and men in the state of Wisconsin. Let's make sure that access doesn't go away. Let's increase the number of primary care providers in our state. Let's get nurse practitioners more involved in this process. Let's get physician's assistants more involved in this process. Let's create an education system that's put more of these people in the pipeline because they're desperately needed in the state of Wisconsin. How about thinking about expanding the role of telemedicine and technology so that we're actually able to access some patients where they are? Let's consider possibly a process where the state of Wisconsin looks at the long-term risk pool of the residents who live here. Okay, not a one-year little band. Let's look at the lifetime risk and then allow service providers to compete on the basis of quality, patient outcomes, and price. There's a lot of things that we can do, but in the end, what we want to do is make sure that we have the best system that provides the best access so that everybody in this state has the health care that they need.
Mayor Soglin.
Well, I've got more pre-existing conditions than any other candidate running. First, I want to talk about access. I don't care whether it's Frederick or UW or Aurora or any of the other hospitals or clinics in this state. Opening your doors and saying, we are here to serve you, is not sufficient. That is not access. Access is based on trust. And for tens, hundreds of thousands of Wisconsinites, particularly families of color, who have not had trust in the healthcare system, they are not going through those doors. They are not going through those doors unless we make some significant changes in terms of how we present the healthcare system to the public. So if we want to deal with pre-existing conditions, if we want to deal with infant mortality, if we want to deal with proper diagnosis, we'd better figure out ways, such as we did here in Madison when we set up Harambe on the south side, which was designed to deal with a 1-mile radius community and actually started bringing in people and attracting folks from as far away as Monroe for what was supposed to be a neighborhood clinic. And this gets to the second point. I love our hospitals dearly, but we are going to have to talk tough with our friends. That's the bottom line. Now, for those of you who are taking notes, I suggest you look up Professor Zachary Cooper at Yale. I've worked with him for a number of years on the question of healthcare costs, and the bottom line is we better understand what is driving up the costs. First, and the most obvious, is pharmaceuticals. We're going to have to make significant changes as to how we purchase, both individually as patients and also as institution, how we purchase those pharmaceuticals and how we make those decisions as to which pharmaceuticals we purchase. Secondly, any of you can go online to any of our hospitals and you will find columns for each procedure, whether it's hip replacement or it's going to be a knee replacement or whatever surgical procedure you want. And you're going to find 3 columns in that chart. It's going to tell you what the charge is for somebody who's fully insured. Hip replacement, $25,000. For somebody on Medicare, it's going to tell you $9,000. And then there's going to be a third column, which is like the sticker price on an automobile. We all know what it is, but nobody pays it. And that'll be $32,000. But what you're not going to see, you're not going to see what the cost of the procedure is. And it's probably somewhere below what a fully insured patient pays and above the cost of what a subsidized patient pays. Now, here in Madison, we had some frank discussions over the last 4 or 5 years with our local hospitals. We discussed these issues, and we have seen the price of healthcare come down. We saw it in the form of the insurance rates that we are paying. And while the rest of the nation was seeing increases of 8 and 12%, and the rest of the state was seeing increases of 6%, we were seeing increases of 1 and 2%. We're going to have to work with the hospitals, with the providers, in regards to what they charge and how those costs are distributed. It also gets to another underlying issue. We do not get reimbursed in Wisconsin the way Florida does for a Medicare patient. And one of the things we have to understand is because some of us have had such good health insurance, that in effect is like opening a spigot, opening a faucet, and sending a stream of cash into the healthcare providers, and that has driven up the cost of health care in our state. Thank you. Oh, and thirdly, yes, all the right things to do about the Affordable Care Act and Medicaid.
Thank you, Mayor Soglin. Just a brief opportunity, I guess, for any rebuttal. Did anybody want a brief rebuttal?
So I would just say to Mayor Soglin that talking tough is great, but a healthcare system has to work for patients and for providers. It just has to. When you're out of balance in anything, I don't care if it's healthcare or anything else, when you're out of balance, it doesn't work. So the goal should be a system that works for everyone, right? We want to make sure that we're able to provide access to people who absolutely need it, and we have to make sure that the people providing those services are able to make a living too. You heard in the previous panel that having huge losses is not the way we want to run a healthcare system. We want to make sure that that system is there to provide those services. So you have to strike that balance, and that's why it's so complicated. That's why healthcare is so complicated. You have to make sure that you strike a balance that works for patients and providers. Transparency, of course. Let's make it fully transparent, which is not the case right now. You want to understand what those costs are. Let's make insurance coverage easy to understand, right? Let's make it easy to understand. I'm a guy who took on the largest property insurance company in the world. I'm telling you right now, insurance companies do not like paying claims, and they don't like to set forth in their insurance policies the specifics of what's covered or what's not. Let's make that easy.
Mike is first, and then we'll get you one. But briefly, please, because we do have other questions we want to ask.
It should be Wisconsin's goal to be a national leader on healthcare accessibility. We should be aiming to set an example for the nation to follow. It is possible for Wisconsin to make Badger Care a public option available to everybody. I said at the beginning, I grew up on a farm. One of the ways we kept our farm profitable was foregoing health insurance. My entire childhood, we didn't have health insurance growing up. Farmers can gain access to Badger Care. Self-employed people, small business people can offer Badger Care as a public option. It is possible to make Badger Care a public option in our state, available to everyone in Wisconsin, regardless of income. We should not settle for anything less than that goal.
Okay, Kathleen.
That's why we need a Wisconsin-based exchange. A Wisconsin-based exchange, well, it's the only way we have the power to do it. And thinking about competing on cost, outcome, and price, Andy, that's exactly the way I wrote Senate Bill 359. So for all of those of you that really want health care for all, let's think about taking the first step, creating a Wisconsin-based exchange. We can all agree on that.
Great, thank you. This group has heard about some of those issues many times over the years about how we could combine pools, combine systems of administration, lower costs, increase purchasing power, because one of the things that you have increased purchasing power, you can push costs lower. We look at the combination of the three big companies. It was Berkshire Hathaway, Amazon, and Chase, ABC. I should remember that. But why did they combine? Because they're going to have better purchasing power and leverage. We need to think about that in Wisconsin as well. There is opportunities. We're not going to lower the cost of health care by giving people low-cost insurance that's junky. I mean, that's just ridiculous. Those are some of the proposals that are going out there. But I'm supposed to be asking questions. I can't help myself. So one of the issues that I'm concerned about, we've talked about it, and I mentioned it to candidate Matt Flynn, is uncompensated care. We had an exercise here with the group yesterday. We went through some case scenarios, and we saw the small pivots in information and questions that we asked people, that were they getting coverage or not. In the state of Wisconsin, we've seen uncompensated care rise. At pre-ACA, it was about $1.6 billion. It went down to $900 million. It's over $1 billion now and rising because of marketplace disruptions. These are people that do not have health care coverage or have inadequate health care coverage. The medical debt is rising. Charity care numbers are going up. Part of it's a consequence of the fact that it's complicated. As Andy pointed out, and I think we all know, what are some of the things that we can do to help lower those uncompensated care costs? Because after all, we all pay for it. I mean, people talk about socialized medicine. Well, this is socialized debt. This debt gets socialized and redistributed to everybody once we have all that uncompensated care. And for Mayor Soglin, just in Dane County alone, when I looked at the numbers for the hospitals in Dane County, in 2016, it was $150 million. So it's a pretty big problem, and we need some help thinking about how do we reduce that uncompensated care. One of them is identifying coverage.
I'm glad you mentioned charity care as part of the whole picture of uncompensated care, because charity care numbers are going up as well. And one of the ways we can bring charity care back down is to make Badger Care available to everybody. We get people covered under Badger Care, and then charity care goes away. As far as uncompensated care, the other thing I would mention is the Medicaid reimbursement rate. That's something that we can do to deal with the other part of the problem. Not only charity care, which means expanding coverage, but then dealing with the rest of the uncompensated care problem. We've got to deal with the Medicaid reimbursement rate, and we need to raise that.
Uncompensated care will go away if we have coverage for every single person. And to do that, obviously, we need to make sure that we're providing health care coverage, not just through the ACA, but obviously taking Badger Care as a public option and setting up a state exchange, raising the MA rate so that we can capture more federal dollars. But we also need to crack down on the selling of lemon policies. We cannot have people buying insurance thinking that they're getting something, then they go in for a procedure or something, and all of a sudden they end up with a huge bill. Because that is a big source of uncompensated care. It's not just people have no coverage. People go in thinking that they do have coverage, and because it's not a grocery store where you can pick and choose what you want, you get care when you are sick, and then you get a bill some months later, and it's a total mystery how that happened. That's when we get the high rates of uncompensated care that we see. I want to just say one thing briefly. When we talk about making sure people have access to health care and making sure that policies are comprehensive, I'm extremely passionate about women having equal access to health care and making sure that it's comprehensive, that it's covering reproductive health care services across the lifespan, including birth control and access to abortion care. I will not be supportive of any plan that does not treat women as equal people and not charge us more rates just because of our reproductive organs or fail to cover the things that are happening in our reproductive organs. And I think we should demand that from any candidate for governor.
Thanks, Kelda. I agree that the best way to bring down or eliminate cost shifting is to increase access and increase coverage. There's a lot of ways to do that. We've already talked about some of them, expanding Medicaid, the exchange, making sure that the benefit structure reflects what research tells us about coverage. When I think about what's happening right now, one of the reasons that we've seen so many people exit the market and we've seen so many plans exit the market is because of the uncertainty in the market. And the governor has a lot to do with the tone that's set for healthcare. The bully pulpit gives her an opportunity to make increased coverage a cornerstone of her administration. And I think this view from the top really sets a tone that gives stability to the market, even in a time of uncertainty at the federal level. I'm so passionate about taking that first step of setting the framework for the exchange, because what that means is no matter what happens at the federal level, there's stability at the state level. And we've seen this happen in Minnesota with Minnesota's MSHR. When I think about what the legislature's doing right now, pay attention to the bill, Senate Bill 770, that just passed. It's kind of called sometimes the Risk Corridor Bill. It's a program that kind of works like a long time ago. You think about the nonprofit Blue Cross Blue Shield, where we had community rating and everybody paid the same rates regardless of health status and age. Well, and that worked up front. This idea works behind the scenes. It's a way that insurance companies can share profit and losses. It's under the Affordable Care Act. It's a provision that Minnesota took up and saw a drop in rates on the individual market of 20%. We can't get that whole 20% because we don't have our own exchange and we haven't yet accepted the Medicaid money, but both of those are solvable problems. This is a small step forward. If you want to learn more about it, I've written about it this week in my weekly column. You can find it at kathleenbeinhout.org. Thanks.
I'm Andy Gronick, once again, and I want to be your governor. I keep telling you my name because I started this race with no name recognition. So I'm hoping that when you're all done here, you'll remember that name. Okay, so charity care or uncompensated care, whatever we call them, a lot of times people don't classify them the same way. So I think what we should do is get good at defining both. The bottom line is
uncompensated care includes charity care and bad debt.
The bottom line, it is a huge number.
The difference between the Medicaid reimbursement and what's being paid, so that's out of the equation.
Yeah, it's a huge number, right? So if, and don't quote me on this number, but if we're losing 30 cents on every dollar for people who are taking the Medicare, and we're losing 100% when somebody comes in uninsured, we need a solution that will work. So all roads really do circle back to accepting Medicaid expansion and to increasing the reimbursement rate. But think about what's happening right now. We have a governor that went after ACA, and now he wants to come back and say that he's got a bill to prop it up again. He wants to be looked at as a person saving a system that he went to blow up in the first place. That's the kind of broken system that we have in politics and in government that has to change. The fact that people do not come first when a government is thinking about health care is completely ludicrous. It is ludicrous. So whatever those best ideas ultimately happen to be, whether it's making Badger Care available to everyone once we actually study that system and see if it works, whether it's actually creating that exchange or identifying a way for Wisconsin to actually insure the entire risk pool, which is a lot more manageable than looking at 1 year and the risks of 1 year. We'll find those answers, and we find them by working together. That's what has to happen in the state of Wisconsin. We come together on an incredibly complicated process. We bring the people to the table, the patients, the doctors, the nurses, the healthcare providers, the pharmaceutical companies, everyone that should have a word in that play, and we find the best solution for everybody in Wisconsin.
Well, I don't know what I said before that was so provocative, but first, we've got to get everybody enrolled when eligible. We've got to go through the kinds of efforts we did 3 and 4 years ago when we worked and collaborated with the county, and we got out there and did everything we could, door to door, using the media, to get people enrolled when eligible, and obviously we have to expand that effort. I want to deal with the question of cost again. You want to lower that number by 30%? Lower the cost of the care by 30%. This nation is so out of proportion to the rest of the world in terms of what health care costs. We've got to deal with that, and we've got to deal with it head on. Thirdly, I want to come back to access. And I've got plenty of experience in this, having to deal with both the city's efforts as well as our partners in the healthcare area. I want to just give you one example. And again, remember, the clinic, the hospital, always says our door is open. So we've got an infant who's not feeling too well. And the parent says, we'll just tough it out. And so here's the difference. There could have been a cab ride to the clinic. There could have been a treatment at the clinic. Or what could end up happening is it's an $1,100 ambulance ride to the emergency room, which is $1,500 the moment you walk in the door. And then because of the delays, the treatment is far more expensive. Now, why is that happening? What is wrong with the system? Why did that parent not take the initial first steps? Was it because of fear of cost? Was it lack of trust? We've got to get to that very simple question. And we've then got to do something about it. And we are in Madison, and we are working, whether it is that kind of example I've just given, or when we're talking about prenatal care, which has to occur before pregnancy. That's the role of the state, not just the municipality.
Thank you. Thank you. Those are important points. We'd have to address the healthcare costs before we're going to be able to solve some of the other issues. One of the things that, another issue that we've identified and have a lot of concerns about is within the behavioral health space. It is extraordinarily complicated. A lot of us out there work trying to help people navigate that system. Mike Rust and Patty Turner work up in Polk County on that. They've come up with some innovative ways of identifying coverage and services for people with behavioral health. It's actually saving the tax levy some money. But it is an extraordinary expense. There's a process that people go through with an ability to pay screen where there's it's a difficult process that people are paying for services they can't afford, and they then leave that type of service. So one of the areas that we're interested in hearing from you about is more specifically in the behavioral health space. It's opioids, it's behavioral health, mental health. What can we do to help reform that process for people?
This goes way beyond healthcare too, because when you look at corrections policy in Wisconsin, Minnesota imprisons half as many people as Wisconsin, and imprisoning twice as many people here as Minnesota does, hasn't brought down crime. We have states with virtually identical crime rates. But Minnesota does that because of using alternative approaches to sentencing. They put way more emphasis on things like mental health and drug treatment instead of simply locking up people and throwing away the key. Here, both within our healthcare system and then as it bleeds over into corrections policy, our approach has been punitive. Our approach has been to take people, instead of addressing root causes of problems, we always react to the symptoms of those problems. And in some cases, we simply lock people away because of the root causes of the problems they're struggling with. And with healthcare, we have too much of an emphasis on treating sickness rather than focusing on wellness. And so we need to move healthcare policy toward a focus on wellness rather than simply responding to sickness. And over on the correction side, we likewise have to chart a path that's much more like Minnesota's, where we seek to address root causes of problems that result in misbehavior that is not simply an approach of locking people away, warehousing them at an expense of $30,000 a prisoner per year to taxpayers.
We have to treat mental health, behavioral health, and substance use disorder within the public health realm and not the criminal justice system. We have to make sure that people have access to professionals to help them. We have decimated the infrastructure for public health. It is so hard in areas in this state, rural areas and urban areas alike, to get access to care that people need. Even when we do incarcerate people, they don't have access to the treatment that they need. So they're just sitting there wasting time rather than actually getting the kind of mental health and substance use treatment that would help them when they actually eventually are released. And this is a huge problem for our state because we continue to have this negative feedback loop where people's health needs go unmet, then they are funneled into the criminal justice system where their health needs continue to be unmet, and the costs just go up and up and up because we're unwilling to invest in the front end. If we're going to increase access to healthcare providers and healthcare, we need to make it possible for the professionals who do this work to work in areas of high need. And I think one thing we haven't touched on is how expensive it is to go to school and become a social worker, a counselor, a mental health professional like my mom, much less a doctor, a nurse, an NP, or other advanced practice clinician. We need to make it possible for people to serve communities in need in the healthcare context by allowing them to either have their student debt repaid, lower the cost of tuition, and refinance their student debt. For people like me who already went to school and have debt, we need to be able to refinance it. So I think that's a little piece that we haven't talked about. I'm also very cognizant of the time, so I'm going to pass the mic.
Yes, thank you.
There was a provision that was passed in the 2009 budget that actually the Walker administration decided to implement, and Kitty Rhodes helped to do that. It allowed for a coordination and partnership across counties. And there are several counties, including Polk and Pepin and other counties in my area that are very engaged in helping each other to create the system that we need that is community-based in the breadth of behavioral health and addiction recovery. The problem is that there's not a concerted inflow of resources to create that infrastructure from the Department of Health and from the governor and from the budget. And I strongly believe that with leadership from the top and the ingenuity and persistence at the local level, that we can create the resources that we need in each and every community, having the counties and the nonprofit groups be our partners in growing that infrastructure. You heard from Mike about why this needs to be done, and I strongly agree with him that it needs to be done. But what we need to think through is the how. How are we going to do that? And the pieces of it are already in place. Even the idea of creating an ARDC for families and children and using the work of the navigators to help link through this network so that, you know, for example, we have one county working really well with teens, we have another county working really well with meth, and another county working really well with heroin addiction. And we use that network of resources to help bring care to the people who need it. It's a huge investment that the state needs to make, but the ingenuity, the genius for creating it is already there, it's already happening. We need to build on that, lift it up, and bring it to the whole state.
Thank you.
Hi, everyone. Andy Gronick again. All right, so I never imagined in a million years I would ever run for public office, ever. That I would ever say the words, I want to be your governor, never imagined that. But I did promise myself when I decided to get into this race that I would not become part of the problem. I am here to take on tough issues. One of the ways that we're going to get funding to take on these things is by taking on the companies that told their prescribers that opioids were not addictive. Well, as your governor, and if you may recall, the cigarette companies made the same claim, right? They said for decades that cigarettes did not cause cancer. And they defended claims for decades until they lost, and then they paid billions. Well, we have drug companies that went out and said opioids were not addictive. And they are, and we know they are. And we're in a state right now that's breaking records with hospital visits, right? You all saw the news, right? We're at the top of the leaderboard right now. Well, when I'm governor, we will go after those drug companies because the costs that we're incurring as the state of Wisconsin to take care of addiction programs and take care of law enforcement and to take care of incarceration and to be able to provide the kinds of resources that we need to have rehabilitation and to be able to go out and actually try to solve that opioid crisis. We're going to go and seek those kinds of funds from the people who started the addiction crisis from the start. So listen, this is not that complicated. We have to be willing to take on the tough issues, and I'll do that.
I'd mentioned earlier that our city had been part of a coalition of communities working with Shirlane McCray, the First Lady of New York City. We were on a visit last year to the Hill when we were making our effort to save the Affordable Care Act. And we met on the question of mental health with Senator Manchin from West Virginia, and I made the point to him that 30% of the City of Madison Police and Fire Department budgets go to deal with questions of mental health and substance abuse. So when the ambulance goes out, it may be going to attend to somebody with a coronary, but it's probably going to a drug overdose. It's probably going to somebody who was drunk and had a slip and fall. Even the fire truck may be going to an incident where we had a fire started by somebody who was impaired. Well, when I told the senator that, I'd forgotten that he had been the governor of West Virginia. And he said, well, how did you guys do it? In West Virginia, the number is 70%. Right now, part of the problem is that we see the costs in all these other areas, particularly related to public safety and crime, driven by behavioral health issues. Behavioral health issues which we are not addressing. One of the things I'd suggest you do is after you look up all that detail that I described to you from the research of Zach Cooper, is look at two other books. David Kennedy, at the faculty of the John Jay School of Criminal Justice in New York, has written Don't Shoot. And I'm not here texting friends. I'm looking stuff up when I'm on my cell phone. The title on this one's rather long. It's Professor Sharkey at NYU. Uneasy Peace, The Great Crime Decline, the Renewal of City Life, and the Next War on Violence. Behavior health and the treatment of violence as a public health issue is paramount for us to address. We have to get, again, access into the system, but there are other ways of addressing the challenges. There are other ways, and they're particularly discussed in those two books, and I want to pick up on what Senator Vinehout was saying, the word there is navigators. There are community-based people who ought to be supported, who ought to be part of our professional system, who have the keys to the access to the folks who've got the challenges. Remember, there is the stigma of dealing with behavioral health. There are cultural issues that we're dealing with here, and we've got to get those doors open and confront the trauma, particularly that children are witnessing today in our communities. And that has got to be part of the solution, as well as the traditional image of going in and seeing the therapist and sitting on the couch. And it's got to have complete coverage.
Thank you, Mayor Soglin. Appreciate that. We're doing a time check. I just want to say in follow-up, I think, what Mayor Soglin said. We have navigators, we have people, but a lot of us do lack the keys to the system. We have the cars, we're fueled up, we're ready to go, but we just don't have the resources from the state and federal government to do our jobs effectively. We get money taken away from us. We can help people connect to coverage and services. We can help reduce uncompensated care. We just need an opportunity to do that. I want to thank the candidates. I appreciate your comments. I know you're busy people, and we went a little bit over here, but we greatly appreciate all of your efforts and talking to our members of HealthWatch Wisconsin and ABC for Health. It's been a great pleasure to have you, and let's give them all a great hand of applause.